How do you know if you're making progress with practicing the Buteyko method? There's a number of factors to take into consideration. Probably the most important factor is whether you are feeling better. Do you have a deeper sleep? Are you waking up feeling more refreshed? Do you find yourself calmer? Do you find that your breathing is a little bit lighter, that there's less effort involving with breathing? You're not feeling the air hunger that you might have been feeling throughout the day? Or if you do physical exercise with your mouth closed, is that getting easier for you? Do you have symptoms of the nose? Is that reducing? So whatever symptoms you have, do you find a reduction of your symptoms from practicing the technique? And of course, that's the most important aspect in terms of progress. The measurement that we use is called the control pause. Don't get too hung up about the control pause. It's just to give you some feedback. It's the length of your comfortable breath hold time. You take a normal breath in and out through your nose, you pinch your nose and hold your nose, and you're timing it in seconds until you feel the first definite desire to breathe or the first involuntary movement of your breathing muscles, and then you let go, but your breathing should be fairly normal. So your control pause provides you an indirect indicator of your chemosensitivity to carbon dioxide. And without going too technical, but we spoke about how carbon dioxide is the driver to breathe. Some of us can be overly sensitive to the accumulation of carbon dioxide, and this can result with faster breathing, harder breathing, more upper chest breathing, irregular breathing, etc. So ultimately, your progress with the Buteyko method is whether you are feeling a difference to your quality of life, to your sleep, to your breathing during rest, your breathing during movement, and also your state of mind, whether you're feeling calmer. Secondly is your control pause. Each time that your control pause increases by 5 seconds, you are likely to be feeling better. But be patient and persevere with practicing of the exercises. The control pause, you can have ups and downs, and that's normal. And in the first couple of weeks, you might find that your control pause increases by about 3 seconds per week. And then as your control pause is reaching 20 seconds, the control pause can be very stubborn. Physical exercise is the best way to increase the control pause from 20 seconds to 40 seconds. So that physical exercise could be walking with your mouth closed, light jogging with the mouth closed, even doing some breath holds during your physical movement if you're suited to doing some breath holds. Even bringing some breath holds into your walking can be a tremendous way to help improve your control pause. So for example, you're at the gym, you're going for a walk, and early on you take a normal breath in and out through your nose, you pinch your nose and hold your breath, and you hold your breath for maybe 10-15 paces. And then you let go with normal breathing for about a minute or so, and then the next breath hold could be for about 20 paces. So all in all, in terms of your progress, pay attention to how you feel, pay attention to your progress with the control pause, but don't get too hung up about it. If you feel that you're becoming a little bit obsessed with the control pause, forget about the control pause. Much more important is that you're bringing breathing exercise into your way of life. And it's about having a passive approach. It's about understanding that this isn't really a technique. This is more so an understanding that if you change your breathing, you can influence functions of the body. You can upregulate if you want to upregulate. You can downregulate if you want to downregulate. You can improve your sleep, and you can improve your state of mind. So that's what the Buteyko method is about. And enjoy it. That's the most important. And the one thing about the Buteyko method that I will say is that you will experience results pretty quickly. This isn't a case of trying something for a few weeks and seeing, well, what happens. No, you practice this, and especially for sleep, for respiration, and for the mind. And you will find benefits pretty quickly in a few days.